Hello, I'm Dr. Frances Pitzilis. I've mentioned cellular therapy when I was talking about regenerative medicine. Cellular therapy is used for medical and cosmetic purposes, and the two main areas that I use within cellular therapy are platelet-rich plasma and adult stem cells. Platelet-rich plasma is the use of your own platelets, and adult stem cells is extracting your stem cells from fat and using it for medical conditions. I'd like to focus on the platelet-rich plasma because it's been researched for over 30 years, but it's only really come to our attention more so in the last 10 years. And in the last 2 or 3 years, the research has started to firm up. Indeed, we know that we get very good results with knee joint arthritis, for example. Platelets are the little cell components in your blood that will clog up a hole and heal a wound when you cut. And platelets are very good at stimulating the local stem cells in your tissues when they're injected into them, and also platelets release a lot of growth factors. So if you like, the platelets will come into a tissue because they've been injected into it or into a joint, and they'll say, okay boys, what do we need here? Do we need collagen? Do we need cartilage? Do we need blood vessels? And they just release the growth factors that they think are needed, and then that helps the tissues. And in fact, what then ends up happening is that the local stem cells are stimulated as well as the growth hormones helping local tissues to grow. The platelets also have an anti-inflammatory effect and a pain-reducing effect, as well as a growth-stimulating effect. As a result, they're used in a lot of situations. I came across this first about 8 years ago when I learned how to use it for cosmetic medicine. But then I quickly realized that it was very useful for soft tissue conditions like shoulder problems, tennis elbow, wounds that won't heal. And then I found out that the research, and more recently it's been confirmed, that you get an 80% positive result when you inject it into knees that are mild to moderately osteoarthritic. Now imagine if you were a tradesman and having a knee replacement would mean that you could no longer work. I think it's very important to utilise this wonderful natural modality of platelet-rich plasma so that we can avoid or defer the need for knee or hip joint replacement. Platelet-rich plasma comes from your own blood. The nurse takes your blood and then it's spun in a special way so that the platelets form their own layer in the test tube. That platelet-rich part of your plasma is then used therapeutically. So there's no risk. The only danger may well be from having an injection, having a bruise, but we do prefer people to fill in our consent form that outlines all the conditions that we need to be cautious about and that perhaps we shouldn't do the treatment with this condition. The current advice on how often you should have platelet-rich plasma is that in general terms you should have 3 treatments 1 to 4 weeks apart, depending on the scientific literature that you look at, and then 1 treatment per year or a bit earlier to maintain the effect. In my clinic we have had very good results with shoulders, hips, knees and soft tissues. So I think this is a treatment to watch for the future.